I was out of Valley for last 2 or 3 days, so I couldn't upload the fifth video. Let's go ahead, my doctor friends. The structure removed in Whipple's operation. Whole of duodenum up to 10 centimeter of proximal jejunum. Head and neck of pancreas, including uncinate process. Distal 40 to 50% of the stomach, lower end of CVD. Gallbladder, pericholedochal, periduodenal, peripancreatic lymph nodes. Structures removed in radical nephrectomy. Kidneys with Gerota's phase, removal of ureter, adrenal glands, renal vessels, and local lymph node. Quadrantectomy, axillary dissection, level 1. Okay. And postoperative radiotherapy by Umberto Milan Varans. Toilet mastectomy. Palliative mastectomy is done to get rid of foul-smelling fungating mass. Role of hormonal agents. Premenopausal tamoxifen, LHRH analogs, goserelin, progestin, megestrol acetate. Postmenopausal tamoxifen, anastrozole or letrozole, and pregal. I can't read this one. Just have written pre-gallets, something like that. Okay, and the words are very professional, so if that is missed one time, it's very difficult to pronounce or even to recognize. Common sites of distant metastasis of breast: bones 50 to 60%, lung 15 to 20%, pleura 10 to 15%, soft tissue 7 to 15%, liver 5 to 15%, brain, adrenals. Okay, continue. 10 notes in this video as well. Let's see whether I can upload the next video. I mean to say sixth one by today or not. Let's think about the fifth one. Skin and subcutaneous tissue disease, 5-year survival rate is stage 1 more than 90%, stage 2 more than 70%, stage 3 more than 35%, stage 4 less than 2%. Blue nevus, the dermal nevus type. Delaney used Mesna, atramycin, ifosfamide, and dacarbazine alternating with radiotherapy. Capillary hemangiomas, salmon patch, port wine stain, strawberry angioma, spider nevus. Raynaud's disease treatment: avoid exposure to cold. CCB, nifedipine as cold treatment, cilostazol, phosphodiesterase inhibitor, early treatment of nail bed infection. Pathological changes in tubercular lymphadenitis. Stage of inflammation, stage of abscess formation, stage of cholestat abscess, stage of sinus formation. Regime of antitubercular treatment for 2 to 3 months. CAP, rifampicin R, 450 to 600 mg daily. TAB, isoniazid H, 300 mg daily. TAB, ethambutol J, 1000 mg daily. Subsequently, 2 drugs for 4 to 6 months. CAP, rifampicin plus TAB, isoniazid. Secretomotor fibers reach the parotid gland. Trigeminal nerve. Secretomotor preganglionic fibers from inferior salivary. Nucleus, maybe NCL is written. Even I can't read it very appropriately. Joints auriculotemporal of arc of mandibular division of parotid gland. Glossopharyngeal nerve, tympanic plexus, lesser superficial, petrosal, or ganglion, postganglionic fibers. Triceps. This one. Okay, now we have to look at the diagram very well and very carefully, then we understand. Triceps. Lateral intermuscular septum, lateral epicondyle, olecranon, anconeus, deep fascia, post surface of ulna. External carpi ulnaris, external digiti minimi, extensor indicis, ulna. Adductor digiti minimi, external indices, extensor pollicis longus, extensor retinaculum radius, extensor pollicis brevis, extensor digitorum, extensor carpi radialis brevis, extensor carpi radialis longish. Biceps brachialis and brachioradialis. Next one. Berry's sign. Carotid pulse is impalpable due to infiltration of carotid sheath by malignant thyroid swelling. Normal level of thyroid hormones T3 1.5 to 3.5 nmol per liter, T4 55 150 nanomol per liter, TSS is 0.5 to 5 MIU per liter. Sorry, free T3 3 to 9 picomole per liter, free T4 12 to 28 picomole per liter. Medullary carcinoma of thyroid arises from parafollicular CC cells. Causes of leg ulcer, peripheral arterial disease, DM, neuropathy, trauma, malignant ulcer, SCC, inferior ulcer, SLE, SS. Secondary varicose veins due to DVT, arteriovenous fistula obstruction to deep vein by a pelvic mass, pregnancy, IVC, thrombosis, PVD, venous filling time, Harris sign, cross-leg test, physic test. In normal person, the ABPI is more than 1, Raynaud's phenomenon, PVD. Stage 1, a stage of pallor or a stage of local syncope. Stage 2, stage of local sinuses. Stage 3, stage of rate encouragement. Stage 4, stage of ischemic gangrene or reabsorption of terminal phalanx. Teratomus dermoid, ovary, dermoid cyst, testis, teratoma, mediastinum, mediastinal cyst, retroperitoneal cyst, postnatal dermoid. Continue. Secretomotor fibrous, submandibular salivary glands, preganglionic fibrous from superior salivary nucleus, goes to facial nerve, goes to choroid tympani nerve, goes to lingual nerve, goes to submandibular ganglion, goes to postganglionic fibrous, reaches submandibular and sublingual salivary gland. Techniques for repair of cleft lip. Miller's rotation advanced operation straight line repair. Delayer's technique, Lee Mashuri's technique, Tanishion's repair, Mirrored Boyer technique. Timing of surgery for cleft lip and cleft palate. Cleft lip alone, unilateral 5 to 6 months, bilateral 4 to 6 months, cleft palate alone, soft palate only 6 months, soft plus hard palate 2-stage operation. Soft palate 6 months, hard palate 12 to 15 months. Cleft lip and palate unilateral 2-stage operation. Cleft lip plus soft palate 5 to 6 months, hard palate plus alveolus 12 to 15 months. Bilateral 2-stage operation. Cleft lip plus soft palate 4 to 5 months, hard palate or plus alveolus 12 to 15 months. Distribution of carcinoma tongue. Post 1/3. 25% plus 25%, anterior 2/3, 75%, lateral margin 50%, dorsal 5%, tip 10%, ventral surface 10%. Volvulus, abnormal rotation of bowel around its narrow mesentery causing obstruction of lumen. Macroscopic type of gastric carcinoma, proliferative, ulcerative, infiltrating, arterial Jacquard's cup. Incisions for open appendectomy, McBurney's Gradiran incision, Lance incision, midline incision, right paramedian incision. An injection of Buscopan. Buscopan 20 mg IV is given to overcome colon spasm. Reliable mammography for evaluation of breast malignancy sensitivity: true positive 90%, false positive 10%, false negative 8%. Colorectal carcinoma is look at the diagram, friends. Decomposition is 12%, 0.5% at appendix, 5% ascending colon, right to sigmoid junction, nephritic flexure 2%, 5.5%. Okay, so I'm not telling you all the parts very clearly right now. That's why looking at diagram, I'm listening to the percentage digit is very important. Okay. We continue over here. 3% is splenic flexure, then descending colon is about 4%, sigmoid colon 21%. Percent is not written very clearly over there. And colon recto sigmoid junction, I can feel it's like 2 or 3% or 21%. That's so bad, I feel. Let's see, it should be altogether 100, right? Okay, so 38% at rectum, rectum, and 2% at anus. Now we look at diagram of a stomach. 2% carcinoma stomach, and pyloric region 47%, 23% according to picture, 47%. Okay, then pyloric region 47%, body 23%, cardiac 21%, fundus 2%, linitis plastica is 7%. Thumb sign, epiglottis, stipple sign, corkscrew sign, diffuse esophageal spasm, claw sign, intussusception, Berwick sign, achalasia, rattle sign, CT severity index, bulger, necrosis, scar. Okay. Rattle. Oh, that is from another piece. I should have very good reviews and before I begin to record this video, but because of lack of time or because of my laziness, I couldn't do this one. Sorry, my friends. Okay. Mushroom sign. Okay, and if I make it better, I will delete the previous videos and I will upload new ones. So I request all of you, my friends, to comment on this video. What's the percentage of successful lens you feel this is? How can we make it better? I don't write and then speak because it takes a lot of time and we have a lot of content to master. That's why I have made a note in the beginning and then reading. So obviously this is a summary of the whole book. Mushroom sign, pyloric stenosis, caterpillar sign, hypertrophic pyloric stenosis, football sign, pneumoperitoneum, coffee bean sepsis, sigmoid volvulus, target plus sign, intussusception, whirlpool sign, midgut volvulus, pancreatic Sjogren, insufficiency steatory, pancreatic endocrine deficiency DM deferent, zones in burn 1, zone of coagulation, zone of stasis, zone of hyperemia, Osner's swollen regime, conservative treatment, anti-inflammatory drugs, appendicular lump, okay, diclofenac, anti-inflammatory drugs, diclofenac or aceclofenac, narcotic analgesic, injection pentozocaine or pethidine, control infections, second or third generation, cephalosporin, cefuroxime, ceftriaxone, alternatively ampicillin plus gentamicin, and metronidazole. Both are grading for acute pancreatitis, no necrosis 0, 33% to 50% for, and what's that? Because it's omitted because a drop of water, so you can't read it right now very clearly. CT severity index, culture, and something necrosis score, and then on, and so on. Okay. Okay, very important point over here. Color code and cannula size: brown 14G, blue 22G, pink 20G, green 18G, and gray 16G. Branches of external carotid artery, ascending pharyngeal artery, superior thyroid artery, lingual artery, facial artery, occipital artery, posterior auricular artery, maxillary artery, superior temporal artery, popliteal artery, anterior tibial, posterior tibial, and peroneal artery. Instruments: the boundaries of popliteal fossa, semimembranous, semitendinous, biceps femoris, medial head of gastrocnemius, bitendon of plantaris, and lateral head of gastrocnemius, saphenous vein plus popliteal vein. Okay, contains of popliteal fossa, popliteal artery, popliteal vein, and the common peroneal and tibial nerve, loose areolar tissue, and popliteal lymph node. Hyperkalemia and hyponatremia, dialysis. Indications of hemodialysis: blood urea nitrogen is more than 80 m equivalent per liter, serum K is 5.5 m equivalent per liter, persistent acidosis, acute volume uploaded, uremic symptoms, minor surgical procedure. Color code and cannula size: blue 22G, pink 20G, green 18G, gray 16G, brown 14G. Okay, we have just learned, and it's a revision, I guess. Yeah, so note is made 2 times. Sometime by mistakenly, we have already made a lot of notes, so by mistakenly we repeat something. That's not bad, because it's a kind of revision as well. Debilitated, that's the correct pronunciation. Very weakened and infirm. Different types of anorectal abscess: perianal, ischiorectal, submucous, pelvirectal, paronychia infection around the nail, complication of piles, strangulation, thrombosis, ulceration, and gangrene, portal pyremia and septicemia, fibrosis, complication of urethral dilatation, false passes, bleeding, fistula formation, infection, and restriction.